my mom got her wish. She got to stay home.
Glad that it's all down in the open.
They were very supportive of our decisions, and it took a lot of weight off of me.
Sometimes treatment will prolong suffering rather than improve quality, and there does come a time where the treatment and the diagnostic testing has a negative effect on the patient, especially if you know what the final outcome is going to be.
Hospice patients Julie Montgomery, her husband Bill, and Stanley Wojcicki all faced a decision after being told they were terminally ill. The option to go with hospice care appealed to them.
I didn't have to keep going through treatments and being disappointed, keep going, running from doctor to doctor, having disappointments. I wanted to know, I wanted to get my life in order. I wanted to know that I had people there that were going to help me and keep me pain-free.
If I was having an attack, CHF, and when I have my attacks, they're very painful, and I'd have to wait for an ambulance to come, and then you go lay in the ER. You're there for 6 to 8, 10 hours, 12 hours, and you're in a lot of pain until finally you can't take anymore, and they'll give you morphine. So I'm suffering all those times. Here, right away, they gave me morphine right away, the pain was gone. And then they would treat me, and that just meant so much to me.
Well, he ruled out the operation of surgery. And then he said that radiation might be qualified for it. But when they found out it was 3 spots and 2 different types of cancer, they ruled that out, and they only gave me the chemo treatment. And it looked like, he says, you know, like it was once a week, then it was more and lengthier, and come back for these shots and this and that. And it sounded like to me I was going to be in like 3 or 4 trips a week to the, you know, for a shot, for a checkup. And for me, not for me.
Thank you for calling Community Hospice. Catherine speaking.
The biggest mistake people make is waiting far too long before involving hospice in caring for their loved one.
We provide comfort care and emotional support.
Many people realize how valuable hospice care can be, but they fail to recognize it may be appropriate right now, not sometime later.
That's one of the main challenges and difficulties with hospice in this country, and certainly in this region, is that people often are referred to us late or refer late. Doctors have denial just the way patients have denial. I don't think any of us are really free from that. But it does compromise what it is that we're able to accomplish when we have so little time.
To choose hospice or palliative care is not to choose no care, basically. It's not giving up medications entirely. It's not limiting access to everything that the patient would otherwise have had access to by any means.
I think we're very good at helping patients delineate is what their goals are. Not many other physicians, I don't think, really sit down with patients and say, what are your goals? What do you want your life to be like in these last couple of months? What is your picture, and what do you want?
No one gets out of this world alive, and unfortunately, too many people are suffering at the end that probably would benefit from hospice at an earlier stage.
They have been more than my expectations. They really have. They've helped me so much. And they've really made me realize that, you know, when I had such a hard decision to come up against, that, you know, that I didn't have to do it myself. They were there to help me.